Hi, my name is Delana and this is my medication administration video. Isabel is going to be my evaluator and Erin is my videographer. So we're going to be looking at the situation going on today. So Mr. Wheeler was admitted from my skilled nursing facility. He has a mild history of dementia. Today he is having mild confusion. He is less mobile due to his rheumatoid arthritis, and the provider has written orders for new medications. So what we're going to do, we're going to check the provider's orders first. We see that there is an order for Mr. Wheeler who has an allergy to codeine for erythromycin 250 milligrams by mouth 4 times a day, varicella vaccine 0.5 milliliters subcutaneous 1 time given now, and dexamethasone 4 milligrams intramuscularly given 1 time and now. So we're going to check that with the MAR. So we see that this is for Mr. Wheeler who has an allergy to codeine. He needs erythromycin 250 milligrams by mouth 4 times a day, varicella vaccine 0.5 milliliters subcutaneous given once, and dexamethasone 4 milligrams given intramuscularly and once. So now we're going to get our medications ready. So the first medication I'm going to grab is erythromycin. Erythromycin 250 milligrams by mouth 4 times a day for Mr. Wheeler who has an allergy to codeine, and this is not expired. His next medication is going to be varicella. So for Mr. Wheeler, there's an order for varicella vaccine 0.5 milliliters, and the expiration is within date, so we're good, it's not expired. And then his last medication for Mr. Wheeler, dexamethasone 4 milligrams given intramuscularly now. And all of these are to be given at 0800. So now I'm going to be grabbing my supplies. I'm going to get a pill cup for the erythromycin and then a cup of water. We're going to act like that's water for now. And then we're going to be grabbing some syringes and needles. Okay. So to withdraw both of these medications, we're going to be using a 3 milliliter syringe with an 18 gauge needle. That is 1 1/2 inch. Now this is to only withdraw the medication from the vial, not to administer it. And now we have 2 different administering needles. So the reason why we have 2 different needles is because one is an intramuscular injection and then the other is a subcutaneous injection. Now looking at the varicella vaccine, it's to be given subcutaneously, which means we will be administering it with a 25 gauge 5/8 inch needle, because we use smaller gauge or like higher numbered gauge needles for subcutaneous injections. And so now for the IM injection, we're going to be using a 23 gauge 1 1/4 inch needle for the IM injection. Now before I even go into the patient's room, I'm going to check the meds with the MAR one more time. So Mr. Wheeler has an order for erythromycin 250 milligrams by mouth given at 0800. Awesome. So I'll set this to the side. Now Mr. Wheeler has an order for varicella vaccine 0.5 milliliters. Check the expiration date. Everything's good. And we're going to be using the 25 gauge needle. So I'll put that right there. And his last medication for Mr. Wheeler, dexamethasone 4 milligrams given intramuscularly. 23 gauge needle. Perfect. Okay, cool. Let's go into the patient's room. Hi, Mr. Wheeler. How are you feeling this morning? Good? Awesome. My name is Delana Wynn. I'm going to be your nurse for today. Can you please give me your name and your date of birth? Okay, awesome. Thanks, Mr. Wheeler. So I do see you have an allergy to codeine. Do you have an allergy to anything else? No? Okay, cool. So what we're going to be doing today, we're going to be administering some medications given by the orders of the physician. And so I'm going to pull the curtain for patient privacy, and then we're going to get started. So we have 3 different medications today, 2 oral ones and 2 vaccinations. So whenever I put these gloves on, I'm going to go ahead and check for your skin integrity. Now, can you tell me about your ability to swallow? Can you swallow fine? Okay, awesome. Because we have an oral medication to be given to you today. So we just want to make sure that you can swallow perfectly fine. So I'm going to check your skin integrity in your abdomen. So skin is intact. There's no bruising or edema. And I'm going to check on your deltoid. Skin is intact and there's no bruising or edema. Okay, cool. I'm going to go ahead and raise your bed before we get started. I promise we'll be in and out in no time. This should only take like 10 to 15 minutes. Okay, so before I even give you your oral medication, I want to talk to you about what it is. So erythromycin is an anti-infective. Basically, it's used for infections caused by susceptible organisms. Some common side effects you may experience are nausea and vomiting. So before I give him the medication, I'm going to check it one more time. Erythromycin for Jamie Wheeler, 250 milligrams, not expired. And you did say you could swallow, so I'm going to go ahead and give this to you. And I assessed that the patient did swallow the medication. Great job, Mr. Wheeler. Okay, so your next medication is going to be a varicella vaccine. So the vaccine is used to prevent varicella. Now, some common side effects would be sore site of injection, redness or rash where the shot is given, and then fever. So you have to let me know if you feel any of those symptoms or side effects. And so let's go ahead and prep the medication. So I'm going to clean the top of the medication first. But before I do that, I want to check it one more time. Mr. Wheeler, varicella 0.5 milliliters. Perfect. So I clean the top of the medication. And as I let that dry, I'm going to clean the site of the injection. So I'm going to lift this up, Mr. Wheeler. Now I'm going to go 2 inches from your umbilicus. And I'm going to use this just to tell me, point like a little arrow where it's supposed to go. So I already cleaned the site of injection. And now I'm going to prep my needles and syringes. Like I said earlier, I'll be using an 18 gauge needle. Yes, an 18 gauge needle with a 3 milliliter syringe to withdraw this medication, and then the 25 gauge needle that is 5/8 inches to inject Mr. Wheeler with the medication. So we're only going to be giving him 0.5 milliliters. So I'll fill that with air, inject it into the medication, inject the air into the bottle, and then begin withdrawing. And I checked for air bubbles. There are no air bubbles present. And so I'll take this out, insert this back into the cap, twist it off, and we'll attach it this way. Awesome. So before I give him the medication, I'm going to want to dispose the needle. I'll throw this away to reduce clutter. Okay, Mr. Wheeler, we're going to give you this vaccination. Now, it's not supposed to hurt or anything, but you will feel a slight pinch in your abdomen. So what I'm going to do, I'm just going to pinch this right here and go at a 45 to 90 degree angle. Now on the count of 3, 1, 2, 3. I'll inject it, and we'll hold it here for 10 seconds. How's your morning going? Good. What's been the best part of your morning? Hanging out? Cool. Cool. Awesome. You tolerated that great, Mr. Wheeler. I'm going to hold this here just in case you get some sharps. Make sure he's not bleeding or anything. There we go. What a trooper. So, Mr. Wheeler, before I give you your last medication, let's just walk through it and talk about what it is. So your last medication is going to be dexamethasone. Now, this is an IM medication which will be given in your deltoid. So it's an anti-inflammatory. It's used to suppress the inflammation and modification of the normal immune response. Some common side effects you may experience are depression, euphoria, hypertension, anorexia, nausea, acne, wound healing, bruising, muscle wasting, and osteoporosis. So you have to let me know if you see or feel any of those things, okay? So we're gonna go ahead and prepare. Starting off with cleaning the top of this medication. And then moving on to cleaning the site of injection. So I'm gonna roll up your sleeve, Mr. Wheeler, and what I'm gonna do, I'm gonna put 2 fingers above the chromium process. And then point out my pointer finger, make that little V, clean the area, the site of injection. And then use this to tell me where to inject you. Perfect. So I'm going to be using a 3mm syringe again and an 18 gauge needle to withdraw the medication. And like I said earlier, I'll be using a 23 gauge needle to administer the medication. Uh-oh, no wonder why it was so tough to open. I opened it on the wrong side. So I'm gonna make sure that this doesn't fall out, but I'll open it from this side. Okay, I'll just leave that off to the side. So what I'm gonna be doing next is withdrawing air. Now it says, before I check one more time, I'm actually gonna insert this back. That way we can be safe, take safety precautions, you know? I'll check the medication one more time. Yeah, I will. So Mr. Wheeler has an order for dexamethasone, 4 milligrams, 1 milliliter. Awesome. And it's not expired. So then I'll withdraw 1 milliliter of air, insert it into the medication. Release the air and begin withdrawing the medication. Now I'm going to withdraw past 1 so I can release air back into. And check for air bubbles. There we go. No air bubbles. Okay, awesome. So I'll attach this needle on there, and then we're gonna dispose of this one. We need to get that emptied soon. Okay, Mr. Wheeler. Now we're gonna give you your injection. Sound good? So what I'm gonna be doing is I'm gonna be using the Z-Track process. Basically, I'll hold his skin back here. On the count of 3, ready? 1, 2, 3, going in at a 90-degree angle. Holding it for 10 seconds. Awesome, and then I'll take it out, release, close it using one hand, insert it in the sharps container, throw that away. Wow, Mr. Wheeler, you tolerated this procedure great. I'm so proud of you. Get you comfortable. Okay, Mr. Wheeler, now here's what's gonna happen next. We're just gonna be watching to see if you have any side effects within the next 30 minutes. So I'll be back to watch you or to check up on you in the next 30 minutes. I'm gonna have my friend Isabel lower your bed on this side. This side of the bed isn't working right now. That's great. So the bed is put in the low position. And then that's the lowest position. And so I'll check on you in 30 minutes, but I'm really proud of you and how you tolerated the procedure. I'll put your call light within reach if you need anything. Feel free to call me before then. Don't hesitate at all if you need anything. But yeah, I'm gonna go chart if you need anything. Sounds good. See you later, Mr. Wheeler. Okay, so Mr. Wheeler tolerated the procedure perfectly. What I'm going to do is I'm going to document and then tell you the evaluations of the medications to see what we should be looking for. So, we gave him erythromycin by mouth at 0800. The date is 10:30, and we gave it by mouth. And then I'm going to go ahead and initial here. And so the next thing that we gave him was the varicella vaccine. So we gave him this vaccine in his right abdomen at 0800 on 10:30. And it was given sub-Q. And then I'll initial off saying that I did it. And then his final injection was dexamethasone, given at 0800 on 10:30. IM given in his right deltoid. And then I'll sign off on this. Sign here. And then let's talk about what we should be looking out for. So I documented everything. And now we're just going to talk about things that we should be looking for and his reactions. So when we gave him the erythromycin, we're going to be looking for resolutions of signs and symptoms of the infection that he currently has, which may look like less confusion. And then his next thing that we're going to be looking for the varicella vaccine is prevention of diseases. So making sure, or through active immunity, so making sure that he doesn't get the varicella infection, which he shouldn't. And the last thing we'll be looking for whenever he took the dexamethasone would be suppression of the inflammatory and immune responses in autoimmune disorders, allergic reactions, and neoplasms. But yeah, other than that, Mr. Wheeler should be good to go. Thanks for watching.